So we've established, I think, pretty clearly that this disease has significant both physical and emotional manifestations that impact quality of life and employment and multiple other things severely. One of the things that is fascinating, though, is how patients are treated given that understanding. The next slide is a description of a National Psoriasis Foundation survey that was done a number of years ago, looking at how people viewed their own therapy. And one of the things that I always found interesting about it was about a third of people who have psoriasis, and these weren't only severe patients with severe disease, but with mild disease as well, thought that physicians didn't treat them aggressively enough. Now, my guess is, John, you've run into that issue at some point in the course of your the disease life, as it were. How do you see that in the context of when you deal with physicians if you don't think they're being aggressive enough, and how do you deal with that?
Well, I'll do it in two aspects, from before and today. Before, I was reluctant because I didn't think I had the education, the understanding of the disease. Today is a much different situation. I can challenge, I can ask for more, and I can be more aggressive in my own treatment. I can give you some examples that would probably make dermatologists' hair curl of the scales I used to have on my knees. Were so thick, the only way that I could get them off was to take a tool called the surface form tool that one of the companies in Connecticut used to make and scrape them off. The only danger with that is if you got too far down in the scale, you would start bleeding and then you would cause yourself to have an infection. That was my aggressive approach before. My aggressive approach after was to listen, to challenge, to give me new direction, to tell me what I need to do, and I'll do it. I will follow your direction.
Now, Jerry, it seems like there's a disconnect. Now, I know you're a guy who treats psoriasis quite aggressively, and I think probably appropriately so. But when you have people come to you and they've been told by other dermatologists there's nothing else that can be done versus the topical therapies or something of that sort, how do you try to educate patients who might have heard that before? And what do you try to do to educate other members of your community?
Well, to the first question, I tell them that I can help them. I say, I can help you. I really can help you. And then I look at their skin and I assess the severity, and I sit down and talk to them about their medical background, their medical history, and I go over all the different options that are available. And there is many times some cynicism that's going along because many of these people have been to 2 or 3 or 4 dermatologists before and no one's helped them. And so the first initial visit is so key with a new psoriasis patient. First of all, knowing that this is not somebody that's just coming in with a wart. This is someone that's going to be with you probably for the rest of your career. That's what I do. I try to give them all the options that are available. Sometimes they have to think about it because there's a lot of information. What I'm trying to do with the medical community is, frankly, develop a Bill of Rights, a psoriasis Bill of Rights, where people with psoriasis have the right to be clear. People with psoriasis have the right to see other dermatologists that may be more aggressive, that give them the risks and the benefits. They have the right to be angry. They have the right to look for support. And I think by educating other dermatologists that, it's not necessary that everybody treats everything, but it's appropriate for everybody to give each patient the appropriate referral so that they can get the right treatment.
And Melody, you've been one of the leaders in the Derm Nurse Association for many years and have been sort of leaders in nursing and psoriasis over time. What do you see your primary role in education of patients that might apply to nurse practitioners, physician's assistants, as well as dermatologists?
One of the main things I think about is just helping my colleagues understand what needs to happen and all that a patient goes through to even get to an appointment. Many times patients will seek help. They'll try to get in to see a dermatologist and they'll call, and it can be weeks and weeks before they can get an appointment. When they finally come in, there's not a lot of time that's usually allocated for a visit, and there's a lot of information that needs to be shared during that period of time. So one of the main things I try to do is to help nurses and nurse practitioners, PAs, anyone that has a strong interest in psoriasis, just to try to use educational tools, use their own clinical knowledge, because patients want to know about what the disease treatments are and what the current knowledge and understanding of the disease would be. So I think it's just to use every minute, because a lot of times the medical assistants or others have several minutes with the patient before the physician or someone like myself would go into the room, and then several minutes afterwards. So, and lots of great tools to utilize and just really, really help patients get everything they can with that visit.
Well, speaking of great tools, what are a couple examples of tools that are available to patients either through web-based resources or handouts that you might have that you use that you find are particularly effective for patients?
Well, I'm obviously a big fan of the National Psoriasis Foundation, and I think there are great brochures. They have a website. We rarely give out a hard brochure anymore. Most people go to the web for information, and unfortunately they have very often found information that is incorrect, and you have to spend a little bit of time talking about some of the myths and rumors about the different treatments and about the disease to try to help get them focused on things that they can do that are going to have the most meaningful impact. And then the pharmaceutical companies also provide brochures, particularly around whatever product that they have, and I think that those can be very helpful as well. And then unfortunately, or fortunately, one of the best things that you can do is just to begin to develop a rapport and a relationship with patients and tell them you're not going to cover everything in one visit, but just to get them started and tell them to begin to search and learn more about their disease.